My name is Emily McDonald, and today I'm going to demonstrate how to cut an umbilical cord after a home delivery. So, the first thing we need to do is gather all necessary supplies. So onto a sterile linen, we're going to put a pair of sterile gloves, scissors, 2 shoelaces, and a syringe. And so the important thing here is to make sure that all of this is sterile so that we don't transmit any infections to the mother and to the child. So next we're going to wash our hands for a minimum of 20 seconds. Now we're going to put on a pair of sterile gloves. And again, the washing the hands and the gloves are to make sure that we're not transmitting any infections. So now that we are ready, we need to pick the right time to cut the umbilical cord. So the World Health Organization recommends a delayed cutting. And this means that we need to wait about 3 to 5 minutes after delivery for the cord to stop pulsating. In this way, the baby has received all the blood he needs from his mother to reduce chances of developing anemia. However, we can't wait too long and sort of milk the benefits of the cord, because then the baby could get jaundice. So just picking the right time is very vital for the baby's health. So it's been about 5 minutes after the birth and the cord has stopped pulsating, so I think we're ready to start. So we need to take our first shoelace, and if we were in a hospital setting or the midwife had brought like a birthing kit, we might be using medical clamps or a hemostat for this, but a shoelace works just fine. So the goal of what we're doing right now is to sort of make a tourniquet on the cord to make sure that the baby doesn't experience any unnecessary blood loss. So with using the shoelace, we're going to tie a square knot 2 finger lengths away from the navel end of the cord. So we're going to take our 2 ends of the shoelace, take the right side, place it over the left, and go under and pull. So this way we have the first part of our knot. So we're going to take 2 fingers, measure about that length away from the cord, from the navel end of the cord. We're going to take our string, tie it around, but this time we're going to take the left side, place it over, around, under, and pull. So it's really important that this is tight and the right distance away so that the baby does not, hemorrhage at all. And so the next step, we're going to take our thumb and forefinger and push the blood away from our first knot to make sure, again, we're trying to reduce blood loss. So we're just going to do the same thing, another 2 fingers lengths away from the first knot. So we can take our string, again, we're going to do a square knot, right over left, pull, and then measure 2 finger lengths, left over right, down, and pull. There we go, nice and tight. Now that we have clamped, we're ready to cut. So sometimes the father or another family member will like to do this part, and all you have to do is instruct them on how to do it properly, but I'll do it myself this time. So all you need to do is take your scissors and cut away from the baby, and now the baby is on its own. So the next step we need to do is to examine what we've done and make sure everything's going smooth. So we need to ensure that there's no blood loss, and in this case we're good. And we also need to make sure that there are 2 arteries and a vein on the placental end of the cord. And if not, this is important information to share with the child's pediatrician, as it could lead to some health conditions later on in life. But now we can take the baby, place him on the mother for some skin-to-skin contact, or give him to our birth assistant so that she can do her examination. May Gaskin, a famous American midwife, has a recommendation that we should take a sample of cord blood from the placental end of the cord after the cord has been severed. And so, in doing so, we are able to provide this blood to the child's pediatrician so that they can save the child a poke or 2 on his first visit. And it's also very important information related to the baby's health. So we can store this blood in a test tube or some other. So the cord, we can place it dispose of it in a biohazard container, like so. Or sometimes the mothers like to keep the cord. They can turn it into jewelry, or they can keep it for the baby's health later on. Now that the cord has been disposed of, we need to check the baby every half hour or hour or so for about 6 hours after the birth to ensure that there's no problems with the cord stump. So we want to make sure that there's no swelling, no rapid breathing in the infant, or no hemorrhaging. And so if not, the baby's cool. And so the last step is to instruct the mother and the family members on how to properly care for the cord. So the main thing is to let them know that the cord will fall off naturally in about 2 weeks. And so it will begin to sort of blacken and decay, and then it will just naturally fall off and the baby will have a belly button. And so it's important to let the mother know that they should not put any unprescribed medications or ointments onto it, and also not to try and pull or tear it off, as natural is the best way to go in this instance. And as well, we're going to let them know that all clothing should be loose and breathable so that the baby's cord will heal properly and prevent infections. And finally, they should wash their hands before dealing with the cord stump, again to prevent infections to it. Now we have a happy baby. Thanks for watching. Bye!